A very warm welcome to everybody on this beautiful sunny day in Vancouver. My name is Gita Chud. I think we know most of each other, and you know me, co-president of our Jewish Seniors Alliance, more typically known as JSA. Just wanted to begin to say that in the mail to you from late last week is a beautiful card that features our Light a Candle Hanukkah initiative, where we're encouraging people to make a donation in whatever manner you can to JSA to help support our work. Tammy, later on in the program as we close, will also remind everybody, because I'm sure a few people will be joining in late. There actually could not be a better session that relates to the key pillars of JSA than what we are going to learn about and experience today with our wonderful guests, Megan and Kristen. The key pillars of Jewish Seniors Alliance are outreach, and in this regard, we reached out to all of you who are participants. You reached back to us by joining in the link. We also had a beautiful outreach and reach in because JSA was actually a part of the research study conducted by Kristen and Megan. So beautiful reach out and reach back in. Our second key pillar is education and advocacy. So we know that what I'm just calling our TT&T session, triumphs and trials using technology, is going to be extremely educational and help us going forward in our advocacy at a personal level and also with family and friends. The final key pillar of Jewish Seniors Alliance is our peer support services. That typically refers to our more formal program where we have, we serve up to 200 clients and their families, wherein the clients are really experiencing loneliness and social isolation. So our learnings today will be really important for working in that regard, as our volunteers do, and as well, again, at our personal level with our own peers, friends and older adults. So hopefully you all did receive this beautiful flyer that Jen always creates with us, titling today's session, Triumphs and Trials Using Technology, Social Isolation Among Older Adults. And so we welcome Dr. Kristen Haas, RN and PhD, an assistant professor at the School of Nursing here at UBC, and an affiliated researcher in the Fraser Health Authority. Kristen's research program centers on supporting older adults as they manage cancer, chronic disease, and well-being in domains of symptom science, interesting new terminology for me, self-management, and technology-enabled intervention. And Kristen's joined by her colleague, Dr. Megan O'Connell, a registered doctoral clinical psychologist and professor of psychology at the University of Saskatchewan. We just learned actually that she's now here in town, staying at the beautiful Granville Island Hotel. Megan practices in the area of geriatric neuropsychology. She researches the use of technology for remote dementia care, research in neuropsychology and dementia, and research in cognitive aging, all of which are themes so critical to our learning. So, dear Kristen and Megan, we welcome you. We thank you for being with us. And the screen is yours.
Thank you so much. What a nice introduction. Thank you very much. So I'm going to start the presentation and then hand it over to my colleague, Dr. Hawes. But you're certainly welcome to refer to me as Megan and to Kristen as Kristen. I think that helps make us a bit more intimate in the setting where we have a nice group of you who are staying inside despite the beautiful sunny weather in Vancouver today. So I'm going to start a little bit by talking about what we're going to do today. We're going to talk a bit about socialization in the pandemic, which of course is something we all feel quite acutely ourselves, the findings from the social study, our interpretations, and we'd like to hear from you about your experiences and have some questions for you. So I want to start with why we did this work. So as you know, when the COVID pandemic started, there were many limits on what we could do. You couldn't interact with others in person. And we wanted to understand how inability to interact in person impacted older adults, particularly how older adults socialized. Early in the pandemic, this lack of socialization was considered a real concern by many academics. So in our field, The Lancet is one of the highest quality journals we have. And early in the pandemic, the fact that one of the only mitigation strategies prior to vaccination, of course, for COVID, for the pandemic, was the use of social distancing, which then would have a huge consequence for people, creating isolation and loneliness. And we did know prior to the pandemic that older adults were particularly potentially vulnerable to this. And because at the height of the pandemic, most messaging was around older adults need to be particularly cautious about in-person interactions. So this group was going to be a group that the scientific community was most concerned about. And in a more recent publication, more recent to the initial beginning of pandemic in March, in April, another very highly influential journal article, the Journal of the American Medical Association, or JAMA, talked about how we need to, as a community, come together to use technology to help reduce the social isolation, because social isolation has consequences. So in the light of this call for global action, we started our project. And two arms of our project is one that I led, which is a bit more about what we can do in Saskatchewan to mitigate concerns about socialization, but also the part that Dr. Hawes led, or Kristen led, is to understand how these changes impact older adults and their community and social connections. So she's going to talk a bit about that in a moment. So one of the reasons why there was this global call for researchers to do something about social isolation for older adults is the very long and good quality research that has shown that social isolation impacts the health of older adults. It impacts their mental health. So feelings of sadness and or anxiety would be examples of mental health concerns. Impacts physical health. So heart health and other aspects of health can be impacted by living a life that's socially isolated, and also impacts cognitive health. So I have some of my own work with groups looking at people who have social isolation are more likely to have lower memory performance than those who engage in social activities or who do not feel socially isolated. So we've known this literature for quite some years, and then the pandemic hit and caused more social isolation. Thus, there are major concerns in the literature. So we also have known prior to the pandemic that technology facilitated social connections works really well. There's a strong evidence base that even if you can't get together in the room, using technology to connect with others helps improve the mental and physical health for older adults. I will say that cognitive health literature is a bit newer in this area, so we don't have those data quite yet. So one of the things our arm of the team did as soon as the pandemic started was we used basic technology, telephones, to help train older adults how to get onto things like we're on right now, video conferencing. And we did that early in the pandemic because now, obviously, I'm speaking to those who know how to get on technology. You're here, you know how to use it. You're probably all pros at it and better at it than I am. But early in the pandemic, this was new for a lot of people, and particularly for a lot of older adults. We saw older adults want to get on technology in a way that they never wanted to before. They purchased new technology because that was the only way they could get in touch with their loved ones, but we had to train them how to use it. So we used principles from what we've been doing working with people who have cognitive concerns or cognitive impairment that causes dementia. One of the things we've known for years is you can train even somebody who has major problems learning information. You can train them how to use or learn new skills. But that also works well for all of us, even those who are cognitively intact and just need to learn something new. And that's called errorless learning. So learning something new in such a way that doesn't allow you to make mistakes, and you repeat it over and over again until you're successful and you've learned it. That works for all of us, but it's particularly helpful if there are any cognitive concerns. So we used these principles and trained older adults in Saskatchewan how to get onto technology like this using the telephone. And I will say that I wasn't actually sure it would work at the beginning. How can we walk you through how to get onto a system when we can't show you or we can't work together? But we did show it worked quite well. And one of the things that works really well with it is the fact that you get a relationship with somebody on the phone, and if they have a bit of tech phobia, which is anxiety about using technology, that relationship can really help them get through working through the technology and the fear of technology and the little hiccups that happen when you're learning how to use technology. So we found that actually worked quite well using these techniques like errorless learning, which is one principle of cognitive rehabilitation. And we were able to publish our paper describing how well that worked and how it helped maintain social and community connections for older adults in Saskatchewan. So I just want to think back, because I know this is pandemics now. We're coming up on 2 years. I just wanted to have us reflect on how you felt at the beginning of the pandemic. So other than me, for instance, worrying about myself and my family and how we could maintain social distancing, some of my first thoughts were what this literature called for, which is we need to help people who can't get on technology and who can't access others. But we'd like to find out how you guys are thinking. And if you want to, feel free to share that in the chat throughout, that would be great. And I'm going to hand it over to Kristen. And Kristen, I just realized I forgot to do the land acknowledgement, even though I practiced it. So would you like me to do it before you start?
No, that's okay, Megan. Why don't you write it in the chat?
I will do that. Okay, thank you. Okay, I'm going to hand it over to you, and I'm going to mute.
Perfect. Thank you. Thanks, everyone. And Megan, feel free to let me know if my connection is lagging, and I'll turn my video off because my kids are on Netflix, so things are a little slow here. So I'm going to talk to you about the research that we did and the findings, and we conducted this research here in British Columbia across the province. So Megan already talked about the training that was conducted in Saskatchewan. And in British Columbia, what we did was we did some interviews with older adults in the community. We did a random survey, So we got people from all over the province, and we also did what's called an environmental scan of seniors groups in BC. So we had some elaborate ways of reaching out to groups across the province just to understand what sorts of changes they've made. And so I will talk to you about each of those pieces to give you some of the evidence about what we learned. Thanks, Megan. So for the older adults portion, I don't have this written on the slide, but what we did was Megan and I first conducted a large population-based survey in both Saskatchewan and British Columbia, where we talked to 400 people in each province, 400 and they made around technology use in since the pandemic began. Then we asked those 400 people who would be interested in having a follow-up interview, and this is how we came up with these 41 people. So 41 people, I think they were between the ages of 65 and 102, and we asked them questions about socialization, isolation, and technology. And then we also did this work with community groups where we reached out to community groups all over BC. So we had the island, we had all 5 health regions, the north, and we did interviews with 26 of those groups to understand the changes that they made to their programs and how these changes affected their older members. Slide, thanks, Megan. So from the interviews, and you know, to some extent from the surveys as well, we learned that people changed how they socialized. People had to make decisions sometimes really hard ones about how much they would actually socialize in person. And people also felt really isolated, which is not a surprise. Slide, Megan. So people changed how they socialized. You know, we found that older adults really missed out on their social activities. I missed out on my social activities as well. And they looked for other ways to socialize, sometimes using technology or video calls. They were also doing more activities around the house. For those who had spouses, they were, you know, playing cards together, playing board games, and trying to keep social connections by getting help or giving help to family, like grandchildren, teaching them how to use FaceTime or texting more, using those other types of interaction. Some felt comfortable meeting their friends outdoors where they could stay apart physically, and meeting outdoors was obviously easier during the warm summer weather than in the fall and winter. Slide, thanks. Older adults also had to make decisions about how much to socialize. And I found that the decision-making process was really interesting. And it really depended on how comfortable they felt with in-person activities. Many older adults felt more vulnerable to COVID and wanted to reduce their risk, but some also worried about putting other people at risk. So sometimes we would hear from people saying, you know, I'm not worried about myself, you know, I've lived a good life, but I am worried about giving my granddaughter this, or, you know, one individual had a daughter who had cancer. So they were really worried about their daughter being immunocompromised. Some older adults also told us that their decisions about where they would go were based on how specific restaurants or specific locations actually followed those public health guidelines. So there's a lot of different factors that went into that decision making. And people felt really isolated. They had been limiting their social interaction, but that was obviously bad for their well-being. They were trying to engage in activities they could do alone, like biking or fishing. But I've heard repeatedly in this study, as well as in another study we were doing in Ontario with older adults with cancer, like fishing by yourself is no fun, you know? So many of these activities were activities that people really found joy in when they were doing it with someone else. So what really helped people to feel less isolated was, you know, just thinking about the future of the vaccine. So this was this was prior to when people were vaccinated. So the idea of being vaccinated or having a vaccine really helped. People talked about how a positive attitude could help. Having a close social network that they were able to maintain using technology was seen as a real helper. People who were introverted and were more comfortable doing things on their own or spending time alone felt like they could handle this, like this was something that they had done before. And also those who lived in rural areas would tell us that, you know, they were used to this isolation. This is something that they had done before. So they felt that they had the skills to be able to do that. What made it worse for people was when they didn't have close family that they could connect with. They had recent loss or big life change, like a partner who had passed away prior to the pandemic, or I recall one individual who was sort of just adapting to being a widow. And then the pandemic hit and it sort of upset all of their routines, and it was sort of like a re-traumatization. If they had young grandchildren that they couldn't see in person, you know, for some individuals, a year or two. And if they had large social networks that they couldn't see in person and weren't able to maintain those connections. I'm just going to turn off my video because I think my connection is quite weak. So what we found from these interviews was socialization isn't just something older adults want, it's something that they need. And as Megan said, is that this is really clear in the literature. We know that social frailty can lead to physical frailty and physical decline. So it's really important that we find ways to actually maintain and support older adults to have these connections. Thanks, Megan. So that's where community groups come in, in my opinion. I think community groups have, based on this research that we did, have had a heroic task in front of them, especially with seniors, to support them during the pandemic. Many of these organizations did not have a lot of resources and did work that was amazing. So I'll talk about the advantages. I'll talk about some of the barriers that organizations found as they were moving online. And then I'll talk about some of the facilitators to being online and what helped them. So moving to a virtual format for many of these organizations meant that some older adults couldn't participate because they didn't either have the resources or they just weren't able to get online. Participants and instructors could join from other provinces or countries, and people could try brand new activities and programs like virtual museum tours. And I'll just go back up to the last bullet point. I got a little bit ahead of myself for a moment. You know, I guess one of the benefits really was that people who couldn't get to the centers in the first place could now actually, you know, access these programs. I had a similar thing as well because you know, I have young kids and I couldn't do a lot of activities in the evening because my spouse was often away. So I found that I had access to a lot more things once the pandemic started compared to, you know, pre-pandemic, whether it was exercise classes or, you know, additional learning classes that I could take. All being online was really helpful. And that was the same sort of premise for these community groups. Next slide, Megan. So what was really hard? What was really hard for these organizations was when their patrons or the older adults didn't have the devices that they needed. So they didn't have a computer or a tablet or a telephone. They weren't familiar, the individuals weren't familiar with how to use the software. I recall talking to one woman in the interviews who said, you know, I worked in technology in the 80s and 90s, but she just found that technology changed so quickly, it was very difficult for her to keep up with it. They also found, the community organizations found that when younger people were offering technical support to older people, they didn't necessarily understand what the older adults needed. So it was a bit of a disconnect, you know, they're trying to offer the support, but it's not being given in quite the way that the older adults wanted. For some older adults, their access to the internet was in public spaces like libraries and cafes, and now those were closed. So that was a huge barrier. And of course, online socialization is not the same as in-person activities. And we found older adults and the community groups were telling us, you know, it's not actually the Bible study or the scripture reading or the book club. It's actually everything that happens before and after. So, you know, that was lost. Some older adults were also worried about privacy, worried about connecting with these groups. And For some, there was actual physical limitations. So not being able to hold on to a device or to swipe, that, you know, they had some impairments, physical impairments that made that piece difficult. So the things that helped the organizations to be able to continue to offer their services and to really meet the needs that we experienced then and are still experiencing. One of the things was reaching out to people directly to tell them about their online programs. Folks found that that was a really helpful way. So, you know, sending email blasts doesn't really help if the people don't receive email. So actually phoning people in their membership was important. Where organizations were able to give out devices, if they had donations or they had some organizations here in Vancouver, as well as throughout the province, would actually physically drive and drop off supplies to the individuals. If they say they were doing an art class or, you know, whatever type of class they were doing, they were able to be that connected. They also had people available to help them solve problems with their device or software. That was really helpful. One organization, and you could remind me if it was yours because I can't remember, had lifeguards who were not working because of the pandemic, and the lifeguards were actually the ones who were offering the tech support. And I found that was really interesting that they, you know, they weren't working in the organization in the way that they had previously, so they had sort of repurposed them. Lots of different types of classes moved to that online format, and, you know, all of those were really well received. And it letting individuals join in more than one way. So for example, like today, you have the ability to join by Zoom or by phone was a helpful, you know, a helper. And also asking for those who don't speak English or didn't speak the language that the organization was offering the program in, asking younger people who spoke their same native language to help them was seen as, you know, really helpful and really important. So we don't want to spend the whole time talking. We're really interested in hearing from you now. I know we just gave you a whole bunch of information and, you know, with a couple of kind of stories sprinkled throughout. And what we'd really like to do is we have a whole bunch of questions that we would like to ask you, but we would really like to have a conversation with you about, you know, your questions or your concerns or, you know, your reflections on this work and how we can use this work to, you know, I really liked how Gita said, reaching out and reaching in. That's such a useful analogy. And so, you know, we'd like to know how we can sort of continue in that process. So as we enter into that question and, you know, discussion period, we'd just like to thank the members of our research team who are located both at UBC, the University of Saskatchewan, and Simon Fraser University, and all of the funders who made this work possible. So I'm going to, I'm not sure who would like to moderate the discussion. Megan, if you want to, or Gita, if you want to help us do the discussion, whatever works for you.
Thanks so very much, Megan and Kristen. I've got 4 pages of notes already. There are several comments in the chat. Is that something you can see, or would it be helpful for us to read them out? What would be the easiest way?
I can see it, and I'd love to respond to what excellent comment Larry has made here. So
okay,
and everyone,
I'll just summarize or read Larry's comment, Megan, because maybe not everybody's able to read it in the chat box.
So thank you. I will do that, Gita. So Larry says, before we even consider helping the target group access computer technology, it should be pointed out that there is still a significant number of older people and others in the general population who do not have either the Wi-Fi or computers for their personal economic reasons. And I deal with people in rural settings who, it doesn't matter how much money you have, you're not going to get broadband internet access anyway. Mm-hmm. So the more privileged in our society represent the low-hanging fruit, and not enough credits given to the value of telephone connection with this particular group. And I just want to say I completely concur. we, first of all, most of my work is with rural families, and they don't have broadband internet access. And we've been using video conferencing with them for years, but we've been able to leverage the eHealth Saskatchewan network, which has dug internet wires into communities where you can't commercially get broadband access. But the pandemic shut all of those down. So it really did limit what we could do in the height of the pandemic. Now we've been able to go back to using the video conferencing infrastructure that the province of Saskatchewan has put in for rural families. But for a while we were stuck without that. And one of the things that we had to do was purchase a 1-800 line for our Zoom account. So when we had groups or support groups,
100 line.
yeah, we had support groups, people could phone in and connect in a way that worked for them. So some people who had the infrastructure, which of course is a privileged thing, they could connect by video conferencing, but those who didn't could still participate and phone in and not have that cost them any money, because Zoom, phoning into Zoom is expensive, and 1-800 line is really what helps with that. I will say that these disparities were highlighted by the pandemic, and I fear are going to be even more extreme, because healthcare, and one of the questions that Kristen will ask you guys, healthcare is likely going to be hybrid in the future, using a lot more technology and using a lot more remote methods. And I think this is this inequity in our society really needs to be addressed, and access to connection and access to computer technology and money for that really needs to be I think a public policy and a priority for our people, to not leave people behind. So I just wanted to comment on that. I feel very strongly about this. Okay. Hard to reach. Which ones?
I think, yeah, this is a good question to continue on. I think just in continuing with Larry's, and you've got your hand up. Did you want to ask a follow-up? I can unmute you. Oh, no, you're going to have to unmute yourself.
Excuse me. Thank you.
There you go.
Thank you, Doctor. Just a point I'd like to make, where many organizations and institutions threw up their hands when the pandemic hit and just said, we've just have to shut down. There's no way we can continue. The JSA rose to the occasion and we have an army of volunteers of between 70 and 75, and those phone calls which had to replace the face-to-face meetings, became not once a week, but oftentimes as much as they felt it required. Furthermore, our training staff took the tremendous initiative to redevelop our training program, which is always face-to-face, and nobody could imagine or even think about doing it any other way. And we are now teaching this online, a 55-hour course, and our friendly visitors and friendly callers course, which I'm trying to expand our reach right across the province now. Again, telephonically or on these Zoom platforms or Telefonica. So there was no reason. There are initiatives taken, and you could see it. You just have to want to do it. Where there's a will, there's a way, Doctor.
Yeah, that's a great comment. And we did see that, because some of the organizations I can't remember the number of organizations we tried to contact. It was probably greater than 50, maybe greater than 75. Some of them were just closed. Some of them would tell us, like, we're closed. We can't do this. But it was incredible to see the work, and many of the organizations were volunteer run. Some we found that organizations who had more money obviously were doing a little bit better. And I think this for me, the learning from this research with the community groups has been really interesting. Just to see the vital role that they've played in supporting older adults in health and wellness during the pandemic. So I'm continuing to do some work in that area. And we have a paper on this topic that's under review at a very high impact factor journal. So I think that this topic about what community groups are doing is really of interest to everyone. And, you know, I can't congratulate you all enough and say what great efforts you've done, because obviously it has had an impact. And we've, you know, been involved in other research in other provinces as well, in addition to Saskatchewan and BC, where this is what's keeping people going, right?
Doctor, I know, and we'd love to share this model with everybody across the province. And if you know anybody who could facilitate that, we're here to share that. Absolutely.
Yes.
While I have the mic, if you don't mind, I was just, because I'm just typing something else to you, and I'd rather listen and not type it at the same time. There's one other issue, and I'll be quiet. There's the inevitable and perpetual elephant in the room at all times, and that is, how do we figure out how to locate, to search for, and find those truly isolated doctors, because they have become invisible, and not nearly invisible, but out of sight, out of mind invisible. And it's not that anybody is ill-willed or mean about this whole thing, but it is a human function that we have, and I don't know why we were even given it, but this out of sight, out of mind, I don't know if it's a syndrome or what it is, but every human seems to have it, and it's easy to forget people, particularly when you can't see them.
Yeah, Megan, do you want to respond to that? You're on mute. No, you're letting me take it. Okay. Yes. Well,
no, sorry.
Okay.
My cursor disappears on me, so I couldn't find the mute.
Welcome back.
Thank you. As I said, I'm not technologically the most savvy, which is why it's funny I do this work. Yeah, you know, it's actually, you're quite right. This is the $1 million question in this field.
Exactly.
And asking people who can't really help themselves to self-select and come forward, I think is quite unreasonable. And we see that there's a large group of people who do not. And that's the challenge, is all the models are based on self-selection. So one of the things that I think helps to minimize, if you're able to at least identify somebody, which of course, that's the question I don't know how to answer. But once you're able to identify somebody, figuring out what works for them. So groups don't work for a big segment of our population. The extreme introverts cannot stand getting together in groups, for instance. So when you do have social connections or programming, thinking about diversity, not just in terms of sensory or cultural background, but also personality and personal preference characteristics are really helpful. So having a broad spectrum of activities that meet the needs of a broad spectrum of people is going to be more likely to engage people. But having said that, we're still reliant on self-selection and identification. And in the field of dementia, which is usually where most of my work is, there are programs of kind of like a buddy program or volunteers who kind of pair up with somebody. Maybe that's what we need to have, is a social movement to pair up with somebody who doesn't have a lot of other people in their life, or a ad campaign, which are quite frankly outside the scope of any researcher to do, but an ad campaign about the detrimental impacts of isolation and how everyone has a role to play in finding those people and helping to bring them to resources and connections. But again, those resources can't just be group-based. And that is the challenge, is the group-based activities don't work for everybody. But they're cheaper to give, so everybody does that.
Yeah, that's a great idea, Megan, and we should talk more about that second piece. I'll also add that in sort of the cancer area, which is where I do a lot of my work, this is becoming, a standard mechanism for follow-up now. And it's not often video, it's usually just by phone, and folks have very differing levels of interest or comfort in continuing in that way. And I think one of the interesting things is that we found in the cancer related work is that folks don't actually realize that their care and their treatment is actually quite different than it would have been in outside of the pandemic. So, you know, they feel like, you know, it's okay, but, you know, they're missing out on a lot of, you know, it might be the treatment that's changed. It might also be, you know, the interaction with their clinician. But, you know, I was talking with one woman who had cancer, and I asked her about, you know, if she felt like it was different. And she said, well, this is all I have to compare it to. I've only ever had cancer once, so this is kind of it. So I think we do need to think about, you know, how we go forward. And that is actually, I think, Megan, that's one of our questions on one of our slides, is how do we reach those people who are underserved? And so, yeah, we really welcome, you know, other questions or comments. If you have great ideas, we're happy to hear them.
If you want the floor back, Larry, you can have it.
Oh, okay. Thank you. Thank you. You know, as an example, in the UK, they use the post office service. They use the letter carriers, who keep in contact and knock on doors, and don't do a major interview, but just say, how are things?
Yeah.
What you were talking about is how. You're absolutely right. It is $1 million question, but you had the answer, and that is raise everybody's awareness. But you have to do it on a regular basis, whether it's through the church, whether it's through any medium you want, TV, radio. It has to be blasted and raise the awareness of something that has been dormant and hibernating. So you really did have the answer there. The question now is how to do it. You're in a university setting, maybe there should be a task force. Maybe there should even be a course on this. This is critical.
You have a lot of high hopes for the university setting. But thank you. Yes, I agree.
I do, Megan. I do.
Yeah,
I think you people are very capable.
Yeah. Awesome. I can't see names because I am sharing my screen, so I'm wondering if someone with names can call.
Yeah, Leah Levitt, or whoever is using that device. I see your hand up. You go ahead with your question.
Ken has a question.
Yeah.
Ken Levitt here?
Yes, go ahead, Ken.
Are you?
When older persons have been taught how to use computers, do we know how much of the teaching needs to be repeated, or on the other side, how much is retained? And is the real benefit their interaction with the teacher as opposed to their independence on the computer? Just curious.
I'd say yes to all of the above. So again, the training we did was very time intensive. So I don't think it's something that's offered everywhere. And people came to us with goals, then they practiced those goals with us, and then we repeated those over several sessions to make sure they remembered how to do it. So I think that, again, that's not a model that's likely commonly available, but that's what we did. And I also agree, though, that the benefit of working together on a problem, all of the trainers were clinical psychology trainees, so they can kind of do a good job of listening. So likely there were a lot of benefits to them for that too.
So 2:30, we need to be there.
Thank you very much.
You're welcome.
Are we muted? Did you have some more questions for us, Megan or Kristen? Just like, you know, more specific, like this one.
Yeah, I guess one of the questions we were curious about, because we did this work, and, you know, maybe Megan, we should be doing follow-up interviews. I don't know. I don't think you're interested, but maybe we should be, is, you know, about how individuals were, back to the last question, actually, about how people are managing now that individuals are actually vaccinated. You know, how people are managing those social interactions where, you know, we were all told that like the vaccine was the answer, but now, now it's one vaccine, no, it's actually 2 vaccines, or maybe it's 3 vaccines, and who knows where it will end. So I guess one of the things Megan and I were discussing was, how are people managing, is that a concern? Do people have they developed strategies about how to manage that anxiety, or maybe it's not a concern?
I wonder if I could just offer that my experience is there's very mixed feelings about coming back into person-to-person interaction. Some people can't wait and say, if we've been double vaxxed and we have our little cards and we bring our mask, please, please, let's do it. Others are saying, I'm still not feeling comfortable with that. Then that brings up the idea of a hybrid model, and that's not always easy from a tech point of view, to have both in person and at the same time on the Zoom. And I'm sorry, this perhaps relates to a different question that popped up for a moment. One of the really helpful things in the Vancouver area is that once a month, our Jewish Federation organizes a gathering on Zoom of people from a variety of senior serving organizations. And so we all share with each other kind of where we're at, where we're not at, what's working well, some joint initiatives and projects that we can do. So just extending and expanding on the community organization's capacity to interact, share, and learn with each other has been very, very helpful.
Yeah, and that's something that we heard people talking about during, talking with all the different community groups as well, is, how they were trying to look at, this organization was doing this really well, how would they find other organizations that could be doing the same thing, or maybe we should all go to that organization for the peer support, and then for the knitting group, we should all go to this organization. We've sort of heard that from a few different organizations, that they were thinking maybe we don't need to do it all. Maybe it actually makes more sense for us to sort of work together and figure out what our strengths are. And I found that was really interesting as well, because I do think sometimes, organizations are pushing forward in their own silos, struggling. But when we actually work together, I think everybody's needs are served.
Right.
Could I just say something? I was participant in a concert on a Friday evening, and half the people were there in person, and it was also on Zoom, so that you could buy a ticket on Zoom or buy a ticket for in person. And so that's that hybrid model that seems to be working with some organizations very successfully. And actually they had chosen the seating so that people were far apart from each other. And also, so that answered the question that a lot of people might have about being frightened, but the ones who really didn't want to come in person could still participate.
Yeah, that's great to hear.
Mm-hmm.
Because I think it does become a challenge for organizations, big and small, of how you do hybrid, right? It's the same thing with academic sort of conferences. We've gone through this space where everyone's gone to virtual, and how do we come back together? Some people may never, right?
Yes.
Particularly with the climate crisis and travel being quite detrimental to the environment. Many people are reconsidering that as well. So yeah, it's interesting to hear. Is that something your organization is working on, Gita, like hybrid activities?
We haven't begun that as yet. We've had some discussions in that regard, but like to Shani's example, we haven't actually as yet had a hybrid model. So
excuse me, Gita, I don't want to challenge you, but we did at the Sukkah.
Absolutely. I'm so sorry, Larry. Thank you for that. Yes,
that's why we're co-presidents.
At our annual general meeting, a very small group of us, maybe 8 or 10, met in person at one of the synagogues where we typically gather for our AGM. And I think, Larry, help me out, or Jen or Liz, whilst we had 8 to 10 people in person, and we videoed that thanks to one of our members, there were, I think, close to 40 other participants, 60 all in, who joined. And so sorry, Larry, that just went out my mind.
Yeah, well, it's a perfect example, Gita. That's why it's
And it was also outside.
and it was, yeah, we threw in the outside, yeah.
Wow.
And well, sort of semi outside. We had walls, but no roof.
They weren't real walls, but anyway. It was,
Well, okay.
Potato.
There you go. There you go.
I'd like to say something when everybody's done, please.
Shoot.
Yes.
I'd
Tammy.
like to talk about your question about how has it been to interact with people in person? Because we are, like Gita was saying, we are all on such different paths. And I call it our journey to recovery. I don't know what else to call it. And it is very anxiety, imposing, because there are people who are doing everything as if there's no pandemic, and they're fully vaccinated and they're correct to do that. And then there are other people like myself who have a great deal of fear still in going out and going into group settings of more than 3 or 4 people. Because I have a grandchild who's not vaccinated yet. That may change, because the anxiety, I don't think is for myself. My anxiety is now to protect my grandchild. So I think this is the time I think we need more education and we need more knowledge. And these kind of seminars are perfect, these kinds of symposium, but we need to do more and more and more of that to help us get back into society. It's not that easy. It's not that easy. So I think it's a big question, and it's a very good question. And I'd love to see the research after everybody's been vaccinated to a high level of percentage. So I don't know an answer to this, but I think we're moving in the right direction. And I love what JSA is doing, and I would love for us to do a hybrid. On a second side, doing the hybrid is very costly if you're going to do it right, and do it well. So it's not easy. So if you're a smaller organization or an organization like our size, getting the technology is expensive. So we need to, that needs to be considered as well. And maybe there needs to be more funding for that, so we can carry on this way, because I think it's an excellent way to help seniors stay involved.
And I might suggest pooling resources. So
Yes.
for instance, I purchased Zoom Healthcare so I could continue to do the work I do. And then you get 10 licenses with that. So I gave one to the Alzheimer's Society of Saskatchewan. I gave one to a seniors community organization in Saskatoon to help them so they didn't have to pay for it, because I had 10 licenses. So if 10 groups got together and split those costs, you have, and then the 1-800 line is also quite expensive, right? So like there's a lot of things in there that are very expensive. And if you pool together, you might be able to maintain and sustain it, and maybe fundraise for it.
Thank you.
Tammy, I'm curious, just as a follow-up to your question. You kind of said, we need to talk about this more. We need more sessions on it. Are you thinking that it would be helpful to have sessions on how to sort of like manage conversations around, this new normal that we're living in? Like, is that sort of what you're looking for?
I think actually you're triggering something for me now, is that conversations on talking to people who are at different stages of their journey. They are at different places in their journey to coming out of the isolation. And that would be, something useful to help people, help them understand each other and accept each other.
That's been really hard. That's been hard, hasn't it? I know,
Yeah.
I have 3 young kids who are unvaccinated. And so my father's 70th birthday was last year. So this year, my mom was having a 70th rebirthday because she's 71, but you know, and we couldn't go because, you know, people have different ideas about what, you know, being cautious is, and my kids are unvaccinated. So it creates some very difficult conversations. We could all benefit from those skills, right?
Absolutely.
That's why we have people like Megan, the psychologist, to help us through this.
So well, I don't have a clear, easy answer, because if I did, I think it would have occurred to all of you on your own. But I will say that people are much more willing to listen when you're clear about why. So I don't want to get together, so the group is getting together and you're the only one not going out for supper. They might feel quite judgmental that you're not there, and I recognize, I've seen that, and potentially feel rejected. And I think one of the things that we don't tend to do very often is we're not very vulnerable and open. So if you had said or able to say to them, you know, I'm just quite anxious about this and I'm just not there yet. Do you think you can help me out with understanding with my anxiety? That's more likely to get a positive response than trying to say, oh, it's not safe, and giving the reasons and the breakthrough cases. And, you know, so if you're much more open about your feelings and your vulnerability, you do tend to get a better response for most people, not everyone, obviously, but for most people. So maybe that'll help. That's the psychologist answer.
Good.
I was going to say that my book club is hoping to meet in person, I think on the 2nd or 3rd, whatever the Sunday is, first Sunday in December. But there's a few people who, just exactly what you said, are hesitant. So they are going to put out they're going to try and put it on Zoom. I don't know if it's going to work. Some of us will be there and some of us won't, and we'll see if it works. And it's just a small group of people, so certainly not an organization, but we'll see what happens.
So I've been using video conferencing for like the past, well, since 2009. So the math, you can do the math for me. So quite many years for psychological interventions, including group-based interventions. So I will say, if you're going to do a hybrid model where some people are in person and some aren't, having the people in the room discuss amongst themselves leaves out those on video conferencing. So what we have had to do when we have those hybrid models is we have the video conferencing platform. So I'd be sitting right next to the person and we'd be interacting through the screen, not turning to talk to each other, and just reminding each other that all interactions, even within the room, are in the screen. And sometimes that meant, even if we were physically located at the same site, we'd have to connect from 2 different devices. So we didn't have too many people in the room. So that might work, but I know that we had to be very careful to not exclude those on video conferencing when we had people in the room. And it's really hard not to sit and want to talk to the person next to you, but I would purposely almost have a shield up and talk through the screen and keep the group included that way. So if that's helpful, it might be useful to think about.
Thank you.
Just wonderful examples that people have offered and questions, and Larry's correction of me. I'm just wondering, you may have some more questions for us, and at the same time wondering if anybody in our gathering who hasn't had opportunity yet might like to make comment or pose question or give example.
Gita, there is a question, there is a comment from Marilyn Berger in the chat.
Yes, very concerned, still say stay separated and wear a mask. So we were talking kind of about the anxiety spectrum, you know, from very little and low to kind of mid to still very concerned. Sorry, hon, if that's not her last, that's the only quote I'm seeing. And do you have some more questions to pose on your PowerPoints for us?
While Megan's finding her cursor there, I'll just say, you know, one of the things that we found, I mean, even just in teaching university courses is, you know, now individuals who may have missed out on class because they were sick or they couldn't be there are now able to join. So last weekend, I'm teaching a doctoral class, and one of the, she's a nurse practitioner, she's pregnant, she's sick. She was able to join from home, join the class, right? So in some ways, I think that being able to support a hybrid model actually can actually be a really good thing for supporting people to say, like, you know what, I can't leave my house today, or I can't drive, or I don't feel good, you know, I need to be close to the bathroom, or whatever it is, you know, it allows us, and particularly people who have disabilities or may have functional impairments or have, you know, they aren't able to drive, using a hybrid model really improves access. Like I've heard from many people that, you know, who have disabilities, that this is huge. This has been a game changer. And in fact, feeling somewhat upset because for so long, people with disabilities were told, we can't do this, we can't go online. You either come to the conference or you don't come to the conference, you know,
Right.
and now we're doing this. So
Right.
I think in some ways it can be really, you know, there are costs, it's challenging, it's not as good, but if your choice as an individual.
It's a good plan B. I'm just saying it's a good plan B, Kristen, to your comment. And when I see the next question, I just wanted to say that based on our earlier conversation about relationship with the trainer around technology, I can't overstate how much easier and better I feel when, for sessions like this, I can come to Liz's house because I couldn't get the cursor working and her computer is very different than mine. So sitting right beside each other with our coffee and having her smile and say, I'll fix it, I'll do it, is like, yes, thank you. Oh, I think Larry, hand up.
Yes, if you don't mind. On a positive note here, and I don't think we've given enough appreciation to COVID-19, but I'm going to say that, in my opinion and what I've observed, nothing has contributed more to the socialization of our marginalized seniors than the isolation that was caused by the COVID. And it's kind of what everybody is saying here. It's highlighted the situation, just like the disasters in our long-term care finally highlighted the fact that not one, but all four wheels have fallen off our system. And to answer Tammy, and I'll also to confirm what both doctors are saying, Tammy, it's not either or in a hybrid model, because even the same person may be able to join into a particular function today and not tomorrow, may feel differently about it or may feel differently. I think the new reality is fantastic. And Megan or Kristen just brought up the fact that even attending anything, now people are used to it and comfortable with it. I think it's a wonderful thing. And if not for COVID, something would have come up in the future and our seniors would have been suffering more in the long-term care. It's had someone should write a book on the benefits and the gift that COVID was, in fact, especially for the future generations. That's all I have to say.
Segue to this
Thank
question.
you.
Kind of a segue, Larry, to the question that they've just put up. Do you think there's a future to virtual healthcare?
I do. Period. There definitely is. Now, the future is what, tomorrow, next month, next year, 10 years? For sure, it's a reality. Listen, my wife and I have had several occasions to have what you call video conferencing with our doctor. We've done it on the phone. I don't have to see him. I know what he looks like. But a lot of problems have been solved, and it's saved going downtown. And there's speak to your GP and find out how much. And they're much. I think they're able to fit in many more appointments in a day because of how they can control it through the phone. I think it's a wonderful thing. Yes. I think the future is now. I think it's not so much the future, but it's happening. And if anyone's had experience with it, I'd like to hear it. If anyone has anything negative to say about that.
Yeah, you know, one thing I've heard from people who have cancer in particular is, you know, the concern is, I think of one gentleman who said, you know, it was my doctor who saw me and said, something's not right here, and did the tests to confirm that he had cancer. And he was like, you know, I can't imagine if I'd been on the phone with him and told him something's not right, that it would have gone the same way. So
true.
I think about those, you know, I think about those types of comments. And I think really what we have to realize is that it's not one size fits all. And I definitely, I have my 3 little kids, and I've toted them pre-COVID. I've taken them to, you know, how many doctor's appointments where they're picking up sicknesses while we're waiting in the waiting room. And now I can just phone the GP and, you know, well, as a nurse, I'm lucky because I can tell them this is what I need, write me a prescription for this. But, you know, I mean, it makes it a lot easier. So, yeah, there is, I would say, like, my takeaway on virtual health is that it's not a one size fits all. And
Oh, I didn't mean for it to replace face-to-face, not at all. But there's a time and a place for everything.
yeah, definitely.
Marilyn, unmute yourself.
Okay, I agree with Larry. I think it's been fabulous. The fact that I can call the doctor's office, she calls me back. It's a wonderful thing. But I also agree, there's something to be said for being seen in person, because every little thing that I think, I wonder what this is, but I really don't want to go to the doctor. And that could be a possible problem. So yes, I think this virtual stuff is fabulous, but there's got to be a counterbalance to it at some point also.
Like everything.
Yeah.
Well, I guess I'm noticing that we're over time a little bit here, and I'm wondering if there's any other questions, or, you know, we're happy to, I don't think we have our email addresses on the last slide, do we, Megan? But we are definitely, you know, if you want to continue the conversation with us, we are more than happy for you to reach out to us personally. We can provide those addresses to Gita, and happy to continue the conversation.
That would be great, Kristen. Yeah, Liz is just reminding me to say that wonderfully, Jen has been recording the session. So when we're all set and we can upload it onto our website, we can also add your emails that way. And so people who are here today, people not here today and watch the recording, can also then access you via email to continue conversation or pose any more questions.
That's great. And I'll also just put it, yeah, that's wonderful. And I'll also just put in a plug and say that we're always looking for, it's perhaps less relevant to Megan, given that she's in Saskatchewan, but I'm always looking for older adults who are passionate about these topics to join me in co-leading research, because it's so helpful to have people who are, you know, living that experience of being an older adult to work with me. And so, you know, reach out to me if you're interested.
That's great, Kristen. And I'm just thinking about one of our board members, sadly not with us today, but she's studying PhD in gerontology at SFU, Simon Fraser. And she's been doing some surveys, and we've had several focus groups. Whilst her questions aren't specifically related to COVID, there are so many connections, you know, like she's asking us, what in terms of community supports and helps you? Is it walk in the neighborhood? Is it knowing more people in your neighborhood? Your feelings of safety, transit, etc., all of which, you know, very much relate to these topics. So she'd also, I'm sure, love to watch the recording and join in, Kristen, on some of your future gatherings. Wow, what an incredible, the time has just flown by. So I think, Tammy, over to you. Unmute, please. Yeah.
I stay muted because I make lots of noise, even if I live by myself. So I do want to say, and it's my privilege and my pleasure to thank you. Thank you both, Megan and Kristen, for your wonderful information. First of all, for undertaking to do this kind of research. I feel personally, now that I think I'm past middle age, but just, okay, appreciate that there are people out there studying and looking towards making our lives better, and our lives are longer, and we have earned the right to have better lives. And thank you for doing this. We value your research. It's amazing. And JSA, thanks you for allowing us to be part of your research and have your studies so relevant to today's older seniors or older adults, as we're called these days. And I took, like Gita, I took like pages and pages of notes that were meaningful to me, but I think I'm going to turn to the last page and just thank you for mentioning specific things that are so important. Community groups, how important the community is in helping each other. We're a lifeline to each other. So a senior who needs the help today may be the senior who's giving help tomorrow. And also, for one point that you made that really hit home with me, because again, personally, I have a family member who's an extreme introvert, and I happen to be an extreme extrovert. And definitely our needs are different through this pandemic. Definitely. And when you say to offer and be sensitive, to offer a broad spectrum of programs that appeals, and that so that they can hear it and get the help that they need. How detrimental isolation is. You made that point so well. It not only affects our mental health, but our physical health, our cognitive. I never even went that far in my thinking. And how do we go forward? So now I have that question in my mind, and on behalf of JSA, and we're going to keep this top of mind and moving forward and pooling our resources and looking towards a future and a bright future, and hopefully help more and more people as more and more people become seniors, so that we know we're going with knowledge and with understanding. And please keep doing your research and bringing us more and more positive information. So thank you, thank you, thank you for your help, for coming here today, for the research you do. We appreciate you.